Okay, so we're here to demonstrate how we get rid of headaches. I've been using this headache technique for decades. It works almost all the time for tension headaches, which is what most headaches are. Even when people come in and they say they got migraines, if they don't have vomiting and or nausea with it, or seeing auras, usually it's not a migraine, it's just a severe tension headache. So I'm going to hit some trigger points with a tool. You can use whatever you want. You can use a finger, you could use the end of a pen, you could use the end of a spoon. I'm going to use the end of a spoon just to demonstrate the 8 consecutive trigger points that we're going to hit. And then we're going to hit the trigger points at the base of the skull, which causes the skull to contract and which causes a tension headache. So Landon, if you'll give me your hand, first point is right here, and where the thumb and the finger meet, and we're just going to probe in there with a blunt object and do 5 to 8 seconds. I'm going to do all these 8 points in succession consecutively. So now we'll do it on the other hand. It doesn't matter which hand you start with. Those are the first 2. Now if you'll face that way, right under the skull, there's a little depression about 1 inch off the midline. We can go right in there and tap in there for about 5 to 8 seconds. And we're going to do the other side also 5 to 8 seconds. Now Landon, if you'll face me, we're going to come right from the tips of the ears right to the top of the skull, and we're going to tap there on this reflex point for 5 to 8 seconds. That's number 5. 6 is right here between the eyebrows. 7 is right at the hairline, or as in my case, where the hairline was, is right there. And number 8 is at the base of the skull, right in the midline, right under the skull in the midline. Those are the 8 consecutive points. Then I'll say, did that take away your headache? Frequently it will, or they may say, oh, I still have a little headache left here. So I'm going to circle the pain with my spoon or the end of my knife or a pen, and we're going to circle that on both sides, bilaterally. And then we'll ask them if the headache is gone, and frequently the headache will be gone. Now that's good for temporary relief, and it may get rid of the headache for a few hours or even the rest of the day. But the cause of the headache is usually due to trigger points under the base of the skull. So I'm going to come in here. This piece of the bone at the base of the skull is called the mastoid. I'm going to come in, I'm going to feel that, I'm going to press, I'm going to ask, is that